Welcome to the dynamic learning hub of ExcelR at Andheri East. A prime spot conveniently located at just a 5-minute walk from LIC Andheri Metro. In our journey of over a decade, we have proudly trained over 2 lakh students. We have also been recognized by Deloitte, Silicon India, and other accreditation bodies. Experience learning like never before in our spacious and comfortable classrooms. With high-definition projectors and state-of-the-art acoustics in place, we ensure effective learning even to the farthest point in the room. The hybrid mode is a game changer as you can enjoy the benefits of a live classroom from the comfort of your home. Even if you happen to miss any classroom session, you can still attend the same session with the same trainer at the same time at your convenience, maintaining consistency in your learning progress. Wanna get started? Join us for a demo or career chat over a cup of coffee at our Andheri branch. ExcelR. We don't just train, we build careers.
Good evening, all. I hope you all doing well.
Yeah, good evening. Shall we wait for a couple of minutes? I think few more people will be joining.
Yeah, that's okay, ma'am. We'll wait for 2 more minutes.
Yeah, thank you. Yes, good evening, everyone. So, shall we recap a bit whatever we have studied yesterday? Okay. How many of you remember what we have studied yesterday? Just a small recap. All right. Which is the body governing CPT? Yes. Just a minute, I'll share with the questions. Now, good evening. So can we just recap a bit? Everyone, which is the body governing the guidelines of ICD? What is the full form of ICD? Come on, fast. Type in the chat box. Everyone. International Code of Diseases, International Classification of Diseases. Right, International Classification of Diseases, 10th model. And what is CM? What does the CM stands for? What does the CM stands for? ICD 10 CM. What does the CM stands for? Yes, clinical modification. All right. Okay. What was the purpose for designing ICD? ICD was designed for the coding of ICD was designed for the coding of diseases. Okay. Who is provider? Provider meaning by? Provider meaning by? Just fast recap. Provider. What do you mean by provider? Who is the provider? Person or a group that provides, not detailed. Person or a group that provides healthcare service to the patient. He can be a doctor, can be a dietitian, can be a physiotherapist, can be a radiotechnologist, can be a pathologist, anyone. No, provider is the one who is giving healthcare service to the patient, right? Who is providing healthcare service. It can be a dietitian, can be a physician, can be a doctor, can be a radiotechnologist, lab technologist, whoever is providing service, healthcare service to the patient is a healthcare provider, is a provider. Can be nurse, can be sister, can be a ward boy. All right, that is a healthcare provider. Who is the payer? Payer meaning by person or organization who is paying for the healthcare services. Yeah, the person or organization who is paying for the healthcare services, right? What is EHR? EHR. What do you mean by EHR? Electronic health record. EHR is electronic health record and EMR is electronic medical record. What is the difference? Electronic medical record is for the individual use of a doctor and electronic health record can be shared across the organization. Okay. What do you mean by encounter? What do you mean by encounter? Visit of a patient, right? Encounter means patient's visit to the healthcare facility. That is encounter. What do you mean by first stage diagnosis? What is the other name for first stage diagnosis? Other name for first stage diagnosis? Primary diagnosis. Yes. Primary diagnosis. Meaning by for what the patient has come to the hospital. What do you mean by comorbidities? What is the other name by for comorbidities? Secondary diagnosis or the conditions which are associated with the primary diagnosis. Okay. CPT is designed by American Medical Association. Very good. What is the full form of HCPCS? Full form of HCPCS? Healthcare Common Procedure Coding System. Very good. Right. All right. So we all have seen most of it, right? we have seen about all the terms, all the different terms, and we have studied yesterday about the structure of ICD, what is the coding guidelines are there, how the code is designed, what is the structure of the code. Okay, first three characters of the code are called as first three character of the code, ICD code. They are called as category codes. Very good. They are called as category code. And further expansion of the codes are called as further expansion of the code are called as subcategory code. Very nice. Great. Good. So category codes and subcategory code. Okay. Now ICD code always starts with number or alphabet. Always starts with alphabet. All right. Now, one more thing I would like to tell you about ICD is ICD was originally designed. Now, just remember everyone, ICD was originally designed to code the mortality. What is mortality? The cause of mortality. What is mortality? What do you mean by mortality? Death, right? Death, right. So ICD was originally designed to code mortality. Later on, it was changed to code morbidity. Now, what is morbidity? What do you mean by morbidity? Morbidity means diseases, right? So later on, it changed to be morbidity, and that is why we call it as a clinical modification, CM, which means we are now coding morbidity. That can be used for the clinical use as well, not only to code the death or mortality, right? So these are the main points that we have studied till now about ICD. Now today we will be studying a bit about what are the different coding guidelines for certain disorders, mainly just some common diseases like hypertension, diabetes, and hemiplegia. There are multiple chapters, multiple diagnoses. There are many diagnoses from the infections, from cancers to many other diagnoses. But there are certain diagnoses which are often coded, or you should know certain guidelines for them, right? So we have seen the general guidelines yesterday. The general guidelines are applicable to all the chapters of ICD. Now, how many chapters of ICD are there total? How many chapters are there? Let us see how many chapters are there, right? It starts with infectious diseases, 22 chapters, right? 21, 22, right? Chapter A, the code range from A00 to B99, that is the first chapter, and it has all the infectious diseases and parasitic diseases. So all the infectious diseases where virus or bacterial infection, viral infection, protozoal infection like malaria, kala azar, all right, all they are coded using the codes from A00 to B99. We will be seeing certain conditions, but we will discuss in detail about the conditions of, that is, hypertension, diabetes, and hemiplegia. There are certain guidelines you have to remember. Today we'll see these three. A few more we'll be seeing tomorrow, right? We'll be studying about the guidelines pertaining to neoplasm. What is neoplasm? That is cancer. Cancer or extra growth, right? Benign tumors are just, neoplasm simply means extra growth, right? Then chapter 3 is about the diseases of blood like anemia, thalassemia, sickle cell anemia, all these different disorders of the blood that will be coded under D50 to D89. These are the code ranges for this different disorders. Then all the metabolic disorders like hypothyroidism, hyperthyroidism, hypoparathyroidism, hyperparathyroidism, all the endocrine system that we have studied. Okay, all their secretions, all the metabolic disorders that will be coming under E00 to E89. That is chapter 4. E00 to E89 as chapter 4. That is a code range given for all endocrine disorders, nutritional disorders like nutritional anemia, anorexia, all these will be coming under obesity, all right, excessive weight loss, that all will be coming under E00 to E89. And chapter F01, that is fifth chapter, to F99, the code range from F01 to F99 is for all the mental and behavioral disorders and neurodevelopmental disorders, like, for example, anxiety, depression, neurosis, all the substance abuse, okay, like drug addictions, different types of drug addictions, cocaine addiction, cocaine use, alcoholism, they are all given under chapter 5. Code ranges are from F01 to F99. After that, the code for all the diseases of the nervous system is given, and that code ranges are from G00 to G99. Under all that, there will be the codes for hemiplegia, code for stroke, codes for different nervous disorders, encephalitis, encephalopathies, different types of brain disorders, tumors, that will be covered under G00, G99. This is the code range for nervous disorder, nervous system disorder. Then there are H category code. This H category code is divided into two. From H00 to H59, we have the diseases of eye and adnexa, like conjunctivitis, cataract, glaucoma, all these disorders. And H60 to H95, the different disorders of the ear and mastoid process. So hearing loss, then tympanic rupture, acute otitis media, otitis externa, all that you will find under H60 to H95. Right? So this is chapter 7 and chapter 8. Then we have chapter 9, that is for diseases of the circulatory system, myocardial infarctions, ischemia, coronary artery diseases, hypertension, okay, blood pressure. Out of that, we will be studying hypertension, which is a commonly coded, or which is very common. So you should know some of the codes of hypertension. So we'll be studying today about the hypertension. What are the guidelines, how to code all these things, right? So we have the code range from I00 to I99. So all the codes related to heart diseases except the congenital heart diseases. The congenital means, what do you mean by congenital heart diseases? Congenital heart diseases means which are not hereditary. Congenital are not hereditary, they are different. Hereditary means they are genetic disorder. Congenital means which are present by birth. Yeah, from birth, right? That is congenital heart disease by birth, right? So except congenital heart diseases, all other diseases are given in chapter 9. That is I00 to I99. From J00 to J99, we have the diseases of respiratory system, acute bronchitis, chronic bronchitis, bronchiectasis, COPD, pneumonia, influenza. All that will come under this code range, J00 to J99. K00 to K95 is chapter 11. That you will have the disorders of digestive system. All the disorders of digestive system, right from the infections of the oral cavity, problems of the oral cavity, problems of the dental problems, then esophagitis, gastritis, ulcers, colon infections of the colon. All these disorders will come in chapter 11, that is K00 to K95. Then we have studied about the pressure ulcer, the different types of ulcers, different types of skin disorders, hair disorders, nail disorders, that you will find in chapter 12, that is from L00 code to L99. You may not remember all of this. I understand this is not possible to remember in very first session. But if you remember just A, C, B, C, D, okay, you will remember the chapters, right? You will remember the chapters. Slowly, once you start practicing, you will remember. After this, there is chapter 13, which is for musculoskeletal system, disorders of musculoskeletal system, myalgia, muscle disorders, muscle pain. Sorry, give me a minute. Muscle pain, muscle disorder, myopathies. All right, then pathological fractures, all that will come under M00 to M99. Okay, this is the code range, that is chapter 13. Chapter 14 is for the genitourinary disorders, that is like kidney disorders, nephropathies, nephrotic syndrome, then urinary system problems, cystitis, cystocele, then genital problems, reproductive system problems, like uterus, infection of the uterus, malformations of the uterus. You will find this in N00 to N99, along with all the disorders of the breast and connective tissue, right? That you will find in this chapter 14. Chapter 15 is for the complications of pregnancy, childbirth, and puerperium. The conditions which are complicating pregnancy, childbirth, and puerperium, that will be given under O00 to O9A. Now, there is one rule in ICD that we have seen yesterday, ICD general rules. The pregnancy condition codes, that is O category code, which we call it O category code or chapter 15 codes, they take priority over all other chapters. If any condition is there which is going to complicate the pregnancy or complicate the childbirth or complicate the puerperium, if a woman is pregnant and she has any problem, our first code will be from O category code. So O category code take priority over all other systems. They are called as the priority codes. Okay. So O category codes are the priority codes. They take priority over all other chapters. Then chapter 16 is for P00 to P96. It is for perinatal period. Usually the conditions for the babies, the children, not even children, the neonates, the babies. Alright. Then Q is the chapter 17, that is Q00 to Q99, that is for the congenital disorders that we have seen. All the congenital deformities, like deformities of heart, cleft lip, cleft palate, extra digit, all that will be covered under Q00 to Q99. Then chapter 18 is there. We have seen when there are only signs and symptoms present and there is no definitive diagnosis. We have only signs and symptoms, only nausea and vomiting. There is no definitive diagnosis. Patient came with nausea and vomiting, nothing else. Patient came with abdominal pain, as general as just weakness. If the patient comes with weakness or malaise, there is no definitive diagnosis, just simply patient has weakness. So from where you are going to code? What kind of condition it is? This is just a symptom, right? This is just a symptom. There is no diagnosis. So such symptoms are coded using chapter 18 code, where all the symptoms, signs, and abnormal clinical findings are given, right? Then chapter 19 is the code ranges from S00 to T88, and it is the biggest chapter of ICD. It is for injury, trauma, poisoning, and other external causes. For example, burn, corrosion, any mechanical devices, the complication of mechanical devices, the complications of earlier surgeries, complications of drugs, adverse effects of drugs, reactions of drugs, poisonings of drugs and chemicals, all that will be coded under chapter 19, that is S00 to T88. And after that, chapter 20 is the code you can see from V00 to Y99. These are the code where the external causes of morbidity, like we have discussed yesterday, what if there is an accident, if a person has any injury due to accident, the injury will be coded using chapter 19 code. Okay, the kind of injury will be coded using chapter 19 code. That is this code. And the cause of injury, what was the cause of injury, whether there was an accident, whether the patient was driving the vehicle, two-wheeler, three-wheeler, four-wheeler, what, or whether he was driving the truck, whether he was a passenger, whether he was a driver, whether he was a pedestrian, all that will be coded using chapter V00 to chapter this Y99. These are the code ranges. And chapter Z, that is last 21 chapter. This 21 chapter is Z00 to Z99. These are the factors influencing health status and contact with the health service. We will be seeing some of the codes because they are very important codes nowadays. So we see the codes of this Z00, some of the codes of this. And chapter 22 is a special chapter, special purpose code, under which there are certain special categories like COVID. Okay, all the codes for COVID-19 you will find in chapter U002, U85, that is chapter 22, which are the special purpose code. So you will find the codes for COVID in U category and not in infectious diseases. This chapter A to B99. Here you will not find the code for COVID-19. You will find the code for COVID-19 in this. U07.1 is the code for COVID-19. All right, this is the code for COVID-19. So that you will find here. So these are 22 chapters of ICD. Now we will see first certain guidelines pertaining to hypertension today. After that, we'll see the guidelines pertaining to diabetes, coding of the diabetes, and the coding of hemiplegia, that is paralysis, that we will be studying today. So three codes, three conditions we will study today. Right? Everyone ready? Ready? Okay. So where do you think the codes for hypertension will be out of these chapters? Where will you find the codes of hypertension? Where will you find the codes of hypertension? Yes, that is chapter 9. Chapter 9. Okay, for diseases of circulatory system or the cardiovascular system. So that is chapter 9. So we'll see hypertension code. Okay, what do you mean by hypertension? What do you mean by hypertension? Yes. What is the definition of hypertension? Yes, hypertension, which is commonly called as high blood pressure, it means it is a condition where the force of the blood against the artery wall is increased. Okay, the force of the blood against the artery wall is consistently high. This is commonly called as silent killer. Hypertension is commonly called as silent killer. Why? Because it exists without noticeable signs and symptoms. Usually they are not found. There are very few patients who complained of any signs and symptoms. It is present without any signs and symptoms. Some of the patients can give you some signs when it is excessively high. When it reaches excessively high, sometimes patient might have headache or some kind of giddiness. But otherwise, it is silently present without any noticeable signs and symptoms. And that's why it is called as silent killer. Right? It is called as silent killer. Now, when you call it as a hypertension, what is the normal range of the blood pressure? I'm asking you range. Okay, don't give me idealistic figure, please. 120 by 80 is the idealistic figure. Give me the range, systolic and diastolic. Systolic and diastolic. Give me the range. How much is the systolic is the normal blood pressure and how much systolic range, diastolic range you consider as the normal? 140 by 80 is normal. I'm asking you the normal range, Aisha. Normal range. Tell me normal range. Normal range. Systolic and diastolic. What is systolic and what is diastolic? What is systolic? What is diastolic? We have discussed in cardiovascular system. Systole means what and diastole means what? What do you mean by systole? Ventricular systole means the contraction of ventricle. Diastole means the ventricular relaxation, right? So systolic blood pressure ranges, normal systolic is somewhere around 100 to 130 and normal diastolic is somewhere around 70 to 80. So anything which is above this, that will be considered as hypertension. So If it is consistently exceeding 1 by 130 and consistently exceeding, diastolic is consistently exceeding 80. Just one reading will not say it is hypertension. If in one reading it is 140 by 90, and in another readings, another sittings when the patient is coming, the blood pressure is normal, will not say it hypertension. The term is elevated blood pressure if only once it was noticed. That is elevated blood pressure. Okay. But if it is consistently exceeding 130, then it is hypertension. What are the causes of hypertension? What are the causes of hypertension? Can anyone tell me? What causes hypertension? Stress. Okay. Anything else? Stress is right. Okay. Smoking, overthinking, sweat, release, alcohol. All right. Correct. It's a lifestyle disorder, right? This is the lifestyle disorder. The causes of hypertension were primary hypertension or essential hypertension. There are no identifiable underlying causes. No identifiable underlying causes, but there are certain risk factors. For example, with age, it grows with age. Sometimes genetic factors are also involved. Sedentary habit, excessive alcohol, smoking, poor diet, obesity, stress. These are all the just the risk factor, but there is no identifiable cause for primary hypertension. Okay, when the hypertension is there without any known physiological reason or without any underlying pathology, underlying disorder is not there, that is called as primary hypertension. And if there is hypertension due to certain underlying pathologies, that is called as secondary hypertension. Okay, that is called as secondary hypertension, which may be due to different metabolic disorders like hypothyroidism. It can be because of renal disorders, that is kidney disorders, renal stenosis. So if it is because of underlying condition or disorder, we call it as a secondary hypertension. We call it as secondary hypertension. Now, what are the complications of hypertension? There are many complications. Major complications which are common, that are heart attack, kidney failure, blood vessel damage, and stroke. Okay, these are most common complication. Ischemic heart attack, dementia, hypertensive retinopathy, that is vision loss. Gradually there is a vision loss due to excessive blood pressure. So these are certain common disorders like heart failure, heart attack with heart failure, left ventricular hypertrophy, kidney disease, and kidney failure. These are certain common complications of the hypertension. Now, when we were studying about the coding guidelines, general coding guidelines, yesterday, if you would have been attentive in the last few slides, because everyone was willing to give attendance, so I am not sure how many of you were attentive. I talked about the combination code. Does anyone remember about the combination code? What do you mean by combination code? What do you mean by a combination code? And I have given the example also about the hypertension and diabetes, the combination code. How many of you have been attentive enough? Yes, what is combination code? Can anyone tell me? Example. Example of a combination code I'm asking. Combination code is a code where 2 or 3 different diagnoses can be coded using single code. 2 or 3 different diagnoses can be coded using Single code, and I have given you the example, diabetic retinopathy, type 2 diabetes with macular edema, right? Type 2 diabetes with macular edema, that is diabetic retinopathy. Type 2 diabetes with chronic kidney disease, stage 4, stage 2, stages, different stages. Hypertensive heart disorder, hypertensive heart failure with chronic kidney disease. So there are three conditions here. There is hypertension. Because of hypertension, patient has heart failure, and also patient has chronic kidney disease because of hypertension. So three different diagnoses are there, and we'll be using single code for all these three things. So they are called as combination codes. They are called as, what are they called as? Now remember, what are they called as? Combination codes. And if we have a combination code for two or three different diagnoses, do not use 2, 3 codes to describe that condition. Don't use the code for hypertension differently. Don't use the code for heart disease. Don't use the code for CKD unless it is specified by the ICD itself. Unless it is specified by the ICD that use additional code. Otherwise, don't use, right? So that is a combination code. So when there are complications, we have I13 is a combination code. So we'll be studying that. I13 is a code where there are different combinations given for the different complications, right? So we'll study the code range for hypertension. All right. So let us see what are different code ranges. Now we have seen the types of hypertension, that is essential hypertension. According to the ICD, how many types are there? How many types are there? One is essential hypertension. Essential hypertension, that is without any cause, without any identifiable cause, and the category is I10. Shanja, I'll be telling you all three disease combination codes. We will be discussing, there are many. I just give you the example. We will see now. Okay. Essential hypertension is the first code, that is I10. I10 is for essential hypertension. Secondary hypertension. Secondary hypertension, it is due to the underlying condition, due to any disorder, endocrine disorders. Dual coding is required in that. So that is the code for underlying condition. You'll have to use the code for underlying condition, and the code ranges are I15. So just we will just see first today the ICD book. Let me open the ICD book and we'll see the code ranges for that. Okay. Are you able to see the book? Not yet. All right. Then there are code for hypertension with complications. So we'll be studying all those code like hypertensive heart diseases, that is I11 series. I12 is for hypertensive chronic kidney disease. And I13, right now I have said hypertensive heart disease and hypertensive chronic kidney disease. So there are three conditions. Because of hypertension, there is heart disease, and because of hypertension, there is chronic kidney disease. So three conditions are there: hypertension, heart disease, CKD, that is chronic kidney disease. So the code is for that we will be using I13 code. So these three types are there in ICD. I10 is for essential hypertension. I15 is for secondary hypertension due to underlying disorders. And type 3 is with the hypertension with complication. I11 for hypertensive heart disease. I12 for chronic kidney disease, and I13 for CKD and heart disorder. So these are the code ranges or category code that are mentioned in ICD. All right. Hypertensive crisis is the I16 condition, and we will see what does that mean and how to code it. Right. So let me just check if the book is open. I can show you some of the codes. Right. Hmm. I hope you all are able to see the screen of book, ICT book. This book is shared. You can see, you can check in LMS. All right. So first see what all is contained in chapter 9, that is diseases of circulatory system. Okay. So you see here, first you can see the code range, right? From I-10 to I-16 is all hypertensive disorders. Right, those who are raising their hand, please just text your message. Type your message and text it. I will answer. Okay. Right. So you can see here I-10 to I-16. Now we'll go to one by one and we'll see what it is given. So what is given under hypertensive disease? Under that, you will have to use the codes which is given, use additional code to identify the risk factors. To identify the risk factor, that is any tobacco use, any exposure to environmental tobacco, any history of tobacco dependence, right? So these are the additional codes that you have to use. After that, you see I-10 is the first code which is given for essential hypertension, also called as primary hypertension. Also, it means high blood pressure. Also, it means arterial blood pressure, benign hypertension, essential hypertension, malignant hypertension, anything. All this means I-10. Whatever is written on patient's record, out of any of these terms that can be written by the physician or by the provider, it is taken as essential hypertension. All right, it is taken as essential hypertension, right? So that is I-10. After that, you see I-11. It is for hypertensive heart diseases. So the main condition for coding I-11 is that what is important for us, if it is written by the physician that or the provider that patient has hypertension and heart failure. If it is written by the provider that patient has hypertension and heart failure, we need to ask the physician or we need to query the provider that whether there is a correlation between the hypertension and heart disease or not. Whether hypertension, because of hypertension, there is heart disease or not. You have to query the provider. Now, if it is written hypertension with heart disease or heart disease due to hypertension, you don't need to ask anything because it is clear. It is crystal clear that heart disease is because of hypertension. So in that case, you have to use the codes from I-11 category. I-11 category. But if it is not written, if it is written hypertension and heart disease in the documentation, it is always better to query the provider whether there is any relation between the heart failure or not, or heart failure is due to certain other conditions. All right. So essential hypertension, of course, when there are no other complication, that is I-10, essential hypertension. If there are complications of the high blood pressure, the first code is for hypertensive heart diseases. Now you can see we have two different codes here. One is hypertensive heart disease with heart failure, that is I-11.0, and I-11.9 is hypertensive heart disease without heart failure. Without heart failure. And if it is written only that hypertensive heart disease, nothing is mentioned whether heart failure is there or not, you have to take this code I-11.9. And if heart failure is there, you will have to use the code from I-50 category where the types of heart failure are given. So we will go to different types of heart failure. That is the code I-50. So if hypertensive heart failure is there, we will be having two different codes. I11.0, that is hypertensive heart failure, hypertensive disease with heart failure, and I50 category code to identify the type of heart failure. Now you see the types of heart failure are given under this. Left ventricular failure, systole heart failure or also congestive heart failure. Then you can see here combined systolic and diastolic heart failure, diastolic heart failure, all right heart failure, then biventricular failure, end stage heart failure, other heart failure, unspecified heart failure, and at the last you will be having the code for heart failure unspecified. Under that you will find the different terms for that. All right. So this is for hypertensive heart failure or hypertensive heart disease. Now I12 is the code for hypertensive kidney disorder. Hypertensive kidney disorder, we have the code range that is I12. Now see what all is given in I12. Hypertensive chronic kidney disease. Again, the same condition is there under that. The documentation must be there, whether the kidney disease is because of hypertension or not, right? So there must be the documentation that this is because of hypertension. If it is not clear, you will have to call the physician. So here the code range is given I12.0, that is hypertensive chronic kidney disease with stage 5 CKD, or this is called as ESRD. You have to read this term as ESRD. What is ESRD? That is end stage renal disease. And again you have to see here what does the note says. You have to use the additional codes to identify the stage of kidney disease. The stage of kidney disease has to be identified. And the code ranges for stage of kidney disease are given in which chapter? You will find the kidney disease in which chapter? N chapter, that is genitourinary disorder. So the code ranges are given N18.5, that is for stage 5 CKD, and ESRD, that is for N18.6 for ESRD. Right, so these are the code ranges for hypertensive CKD, that is chronic kidney disease. Now I13 is the code for hypertensive heart and chronic disease, CKD. Both conditions are there. Three conditions are there. Patient has hypertension. Because of hypertension, the patient has heart disease, and because of hypertension, patient has kidney disease. So this is the combination code, right? Again, this I20 12.9 is a combination code. I11 is a combination code. These are all combination code. You are describing 2-3 conditions in one code. That is combination code. So you can see here I13.0 where the codes are given for stage 1 to stage 4 CKD and heart failure or heart disease, and I13.1 again CKD and heart failure or heart disease. So these are the code for CKD with hypertension with CKD and heart disease. Now I15 code is there, which is for secondary hypertension, and under that you have to use the underlying code, the underlying conditions. So whatever is the underlying condition, for example, if there is hyperthyroidism, any metabolic disorder which can cause hypertension, renal stenosis, disorders of kidney, certain disorders of kidney that can cause hypertension. So you'll have to use those codes for secondary hypertension. So I15 is the code. So you can see here renovascular hypertension, hypertension secondary to renal disorders, hypertension secondary to endocrine disorders, and sometimes just secondary hypertension might have been written. So these are the codes for hypertension, right? Now last code you can see here is I16, which is hypertensive crisis. Under hypertensive crisis, there are two different things given. One is hypertensive urgency, okay, and one is hypertensive emergency. These two terms are given. So under hypertensive urgency, it means there is a consistently high blood pressure of 200. Crisis. In hypertensive crisis, the blood pressure is usually systolic is 200, 180 to 200, and diastolic is somewhere around 100 to 110. Okay, that is hypertensive crisis. Now, if there is a severe increase in blood pressure without any organ damage, that is hypertensive urgency. And if any organ damage is there, if any stroke is there, any organ damage is there, that you will have to code in hypertensive emergency, that is I 16.1. And we have always we have a facility of unspecified, but it should be used as less as possible. What do you mean by unspecified? What do you mean by unspecified? What do you mean by unspecified? We have seen the term NEC, NOC, NOS. What is unspecified or NOS? What does that mean? No, that doesn't mean not mentioned in ICD. It means not mentioned by the documentation or the provider. Okay. Other classified or other specified, that means we do not have code in ICD. Okay. We do not have code in ICD means other specified. NOS, that is not otherwise specified, means unspecified, means documentation is not complete. So if the documentation does not mention whether it is urgency or emergency, then code unspecified. So these are the codes for hypertension, that is I10 to I16. Any problem or anything that you feel that you did not understand or anything, can you just let me know? Or else I will ask you some questions. I hope this is clear, very simple. I10 is the code for essential hypertension. I11 is the code for hypertensive heart diseases. I12 and the subcategory codes are for hypertension with chronic kidney disease. And I13 is the code for hypertension with heart diseases and chronic kidney diseases. I15 is the code for secondary hypertension. I16 is for hypertensive crisis. All right. Very simple. Very simple. Simple or not? Yes. Okay. So you will remember now very easily, right? Easy to remember? Easy to remember or not? All right, tell me. Category code for essential hypertension. First, answer me that. Category code for essential hypertension. As I said, few codes must be always remembered. All right, few codes are there, and I'm going to teach you those codes only. Those diagnoses which you need to remember if you really want to. Okay, I10, right. Okay, okay. Hypertensive heart and chronic kidney disease. Heart and chronic kidney disease. I12, I13, I15, I16, B, ma'am. Okay. B, ma'am, I15, B, E, I13. Hypertensive heart and chronic disease. Heart and CKD. Yes, I13 is the code. That is right. I13 is the code. Okay. The code for hypertensive crisis. What all is there in hypertensive crisis? Hypertensive emergency, urgency, and I only give you the answer. Emergency. Hypertensive, urgency, and emergency. And what is the difference between urgency and emergency? Difference between urgency and emergency? Organ damage, where? Organ damage, where? In urgency or in emergency? Organ damage in, okay, organ damage not there in urgency, and there is organ damage in emergency. All right, very good. Okay, right, great. Secondary hypertension is caused by, secondary hypertension is caused by, okay. And what is the code range for secondary hypertension? I-15. Okay, code range I-16. No, I-15. I-15 is for secondary hypertension. Okay, it's okay. All right. Underlying medical conditions. Which underlying medical conditions? Can you name one or two underlying medical condition that can cause secondary hypertension? Hyperparathyroidism, CKD, kidney disease, hypothyroidism, renal disorder, renal stenosis, endocrine disorders. Right. Okay. Certain medications also. Okay. Certain drugs or certain medications, they can also cause secondary hypertension. All right. Okay. Now there is one more guideline as we have seen in chapter 15. What I said in chapter 15, anyone remember? Anyone remember? What I have said in chapter 15. Does anyone remember chapter 15? What does it mean? What does it mean? Oh, pregnancy related. Yes. Pregnancy related disorders which take priority over all other codes. So if hypertension is present in pregnancy, or if hypertension is due to pregnancy. Pregnancy induced hypertension means the patient, the woman was not having hypertension earlier. She is now having hypertension because of her pregnancy. That is called as pregnancy induced hypertension. Now, if this is the condition, there are two different terms that is called as preeclampsia and eclampsia. These are severe disorders. Because of the hypertension, there is also the proteinuria. That is, the protein is also lost from the body. That is called eclampsia. And there are certain mental and behavioral disorders also, some signs and symptoms that you will see in preeclampsia and eclampsia. Eclampsia is the higher side, that is higher side of a blood pressure where there is a protein loss also from the body. Okay, so highest is eclampsia, right? Preeclampsia is a milder variety of pregnancy induced hypertension. Now, when we are coding for this pregnancy induced hypertension, we have the code from O category. We have the codes from O category where there are code like O13, O14, and O15. O13, 14, and 15. These are the codes for gestational hypertension or PIH, gestational hypertension or PIH. We will see the code O13, 14, and 15. Just a minute. All right, I'm sharing the screen of ICD. All right, okay. You can see here O13, 30, O11 is for pre-existing hypertension. What do you mean by pre-existing? Means this woman was already having hypertension. That is pre-existing hypertension. Before pregnancy also she was hypertensive. But if this is the pregnancy induced hypertension, which is because of the pregnancy, that is called as gestational hypertension. That is called as gestational hypertension, and you can see here the codes are for gestational hypertension without proteinuria, and these codes are as per the trimester. First trimester, that is first 3 months, second 3 months, and last 3 months of the pregnancy. Then gestational hypertension complicating the childbirth, gestational hypertension complicating the puerperium. So these are the codes for gestational hypertension. Preeclampsia is a condition where there is a protein loss and the damage to the kidneys, and preeclampsia, and after that eclampsia. Okay, eclampsia is a condition where there is, you can see this is HELP syndrome, right? So eclampsia is a condition where there is also the seizures or the conversions. Okay, there is a seizures or conversion. So that is a severe type of hypertension that is present in pregnancy. So PIH, pregnancy induced hypertension. O13, O14 are the code for eclampsia and preeclampsia. All right. Now we'll see the coding of these, right? The severity coding is there. Now, what is the severity coding? It means, see, as I said, they take the priority over all the code. Then the code has to be as per the trimester, first trimester, second trimester. You have to use multiple code for multiple condition. And very important is, if it is given that patient has both preeclampsia and eclampsia, you have to code the condition which is serious. Which condition is serious here? Sequence more severe condition. Which condition is serious here? Eclampsia, because it develops into the seizures. Initially, it was just the protein loss, that is in preeclampsia, hypertension and protein loss and damage to kidneys. But it becomes severe and eclampsia develops, so patient develop conversions and seizures also. So that is severe condition. So if it progresses to severe condition, sequence the severe condition. More severe condition needs to be coded. Do not code preeclampsia. If both things are given on the record of the patient, okay, if medical record of the patient says there was preeclampsia which gradually progressed to eclampsia, code only the severe condition. Most severe condition has to be coded. For example, if earlier pregnancy induced hypertension, Muskan, PIH means pregnancy induced hypertension, also called as gestational hypertension. All right. So if it is only written earlier that it was proteinuria and hypertension, only proteinuria and hypertension written, and after that the signs of preeclampsia develop, code preeclampsia. Okay, code for preeclampsia. If earlier it was preeclampsia and now it is eclampsia, code for eclampsia. Whichever is the more severe condition, it has to be coded. All right. And if any organ damage is there, associated organ damage like renal failure, convulsions, seizures, you'll have to use additional code to identify these conditions as well. Right? Along with these O13, O14, O16 codes, also use the code for the conditions like renal failure or kidney failure and the conditions like seizures. All right, or that can be coded. So multiple conditions, you have to use multiple code because it is important to identify this. All right, so I hope everyone this is clear. I hope this is clear about the coding guidelines related to hypertension. The codes for hypertension is I10, I11, I12, I13 and I15 and I16. But if the if the condition or hypertension is pregnancy induced, take the code from O category. O category codes are there. O9 and O10 are the codes given for pre-existing conditions. Pre-existing blood pressure, right? So for that we have the code pre-existing blood pressure. The codes for pre-existing blood pressure are I10. Okay, pre-existing blood pressure is I10, but pregnancy induced is I13. I11, I13. They are pregnancy induced. All right. So shall we start the coding guidelines for diabetes now? Everyone? All right. What do you mean by diabetes mellitus? What is the diabetes mellitus? Diabetes mellitus is a chronic metabolic disorder which is characterized by increased blood glucose level because either two things is there. Either there is no sufficient insulin or insulin level are sufficient but it is not effectively used, or both condition, insulin is insufficient also and it is not effectively used also. Both the conditions can be there, that is insulin either not present, it is the level is low, or if sufficient insulin is there but it is not effective, or both conditions. Which organ produces insulin? Insulin is produced by which gland? Insulin is produced by thyroid, right? Pancreas. Okay. Which cells of pancreas? Beta cells. Pakka? Sure. Beta cells of Langerhans. Beta cells of islets of Langerhans. Sure. And what does alpha cell secrete then? Right. Glucagon. All right. So glucagon is secreted by alpha cells. All right. They are both these hormones are antagonists. They act in opposed to each other. Okay. Insulin decreases the blood sugar level and glucagon increases the blood sugar level. So now we'll see some coding guidelines pertaining to diabetes. Okay. So again, diabetes, there are different two types of diabetes. Which two types of diabetes are there? Types of diabetes? Type 1 and type 2. What do you mean by type 1? Any other name for type 1 diabetes you know? Insulin dependent. No, diabetes insipidus is not type 1. Diabetes insipidus is not type 1. Okay, please don't take it that way. Diabetes insipidus is altogether different. Yeah. What is another name for insulin dependent? Okay. What else? What else? Juvenile diabetes. Have you heard about juvenile diabetes? Yes, juvenile diabetes. It is also known as juvenile diabetes. All right. Insulin dependent and non-insulin dependent was the concept earlier given. This is not used anymore in the industry. It is not used now. Okay. This concept of saying type 1 as insulin dependent and type 2 as non-insulin dependent, it doesn't exist anymore. It is not of use, right? So don't say that insulin dependent, non-insulin dependent. Juvenile diabetes is type 1 diabetes, type 2 diabetes mellitus, and this diabetes insipidus is totally different. It is totally different. It is due to the dysfunctioning of the pituitary and not because of anything to do with the insulin. Okay, so just this is altogether a different situation or different condition. All right. So type 1 diabetes, also called as a juvenile diabetes, it is because of genetic predisposition or can be due to autoimmune reaction. What do you mean by autoimmune? What do you mean by autoimmune? Anyone can you tell me? Autoimmune disorders means what? Yes, very good. Correct. Correct. Your own body reacts to your own cells as their enemy, and it attacks that and destroys those cells. That is autoimmune disorders, right? So this is Type 1 diabetes is caused by certain autoimmune reaction where the insulin secreting cells are destroyed. Okay, so it can be because of genetic predisposition, but there are certain other conditions like environmental triggers. It may accelerate the onset. Now, there is one condition given in ICD about the type 1 diabetes is that even if the type 1 diabetes is diagnosed at any age, it is still called as a juvenile diabetes. It happens that sometimes there are no signs and symptoms of type 1 diabetes and it can be diagnosed at the age of maybe 40. So, no matter at what age this is diagnosed, it may be diagnosed at the age of 38 or 35 or whatever age it is, it will be still called as a juvenile diabetes or type 1 diabetes. Okay, it is still called as type 1 diabetes. Even it can be diagnosed at the later stages of life. Now, type 2 diabetes, there are as such no underlying causes for type 2 diabetes. There are no causes, underlying causative factor. There are lifestyle disorder, this is lifestyle disorder, poor diet, sedentary lifestyle, obesity, some genetic factor, age, gestational diabetes, history of gestational diabetes. All these can be the risk factor for type 2 diabetes. But there are no particular reasons behind type 2 diabetes, right? It is just a genetic disorder or sometimes can be because of the lifestyle stress, right? Stress. All right. Now we have seen gestational hypertension. Similarly, we have gestational diabetes. So it is the pregnancy hormone. They are interfering with the production of insulin, which results into the gestational diabetes. Like we have seen pregnancy-induced hypertension. Similarly, this is the condition pregnancy-induced diabetes or gestational diabetes. Both terms are same. All right, pregnancy-induced diabetes or gestational diabetes. Other causes of diabetes can be pancreatic diseases like pancreatitis, tumors of pancreas, cancers of pancreas, some hormonal disorders like Cushing syndrome, acromegaly, certain medications, certain indication, the infections, certain genetic disorders, they can cause diabetes. All right. So we will see what our ICD says about it. What are the common complications of diabetes? You know, there are many complications of diabetes. How much do you know? Let me see. How many of them you can enlist? Can you enlist the complications of diabetes? Yes. Diabetic nephropathy. Yes, very good. Diabetic retinopathy. Very good. Yes. Diabetic neuropathy. Perfect. Kidney damage. Ketoacidosis. Very nice. Okay. I hope you are not finding it from Google. I hope you know it. Okay. So don't tell me from Google or ChatGPT, please. Tell me from your AI, your NI, natural intelligence. Don't use AI. Use your natural intelligence. Alzheimer's. Okay. Neuropathy. All right. Diabetic foot. Heard about diabetic foot? Necrosis of the foot. Diabetic ulcers. Depression, stress. Okay. Foot gangrene. Right. Right. Cardiac problem. Cardiopathy, retinopathy, myopathy. All right. Atherosclerosis. All right. Many of them. So there are many complications. Kidney disorder, nephropathy, neuropathy, right? Arthropathy, that is disorders of the joints. All right, these are all the complications of diabetes. Now, similarly, like we have seen in hypertension, for diabetes also we have the codes for complications of diabetes. All right, we have the codes for complications of diabetes. E10 is the code for type 1 diabetes. E10, that is the code for type 1 diabetes. And under E10, you have to use the underlying causes, if any. All right. There are many codes used in diabetes from E08 to E0. So E13 are the codes. E08, E09, E10, E11 are the code ranges for diabetes. Type 1 diabetes code is E10. Type 2 is E11. All right. E08 is for any underlying disorder, which is secondary diabetes. E09 is the diabetes caused by any drugs, that is drug-induced diabetes. And E13 are other diabetes. So we have the code E09, 8, 9, 10, 11, 13. These 5 types of different codes are given. 8 is for the secondary diabetes due to underlying metabolic disorders. E9, E09 is the code for drug-induced diabetes. E10 is for type 1. E11 is for type 2. E13 is for diabetes not specified as type 1 and type 2. So these are the codes, right? Now there are many complications and there are many codes. Each of these codes has further expansion with the complications of diabetes. All right, with the complications of diabetes, we will see the complications and all these things which are given under the right. You see, first code is E08, which is diabetes due to underlying condition. You have to first identify the condition. Code first the condition. Now, if you have really sincerely attended yesterday's session, I told you that there is one clause for cause and manifestation. That is etiology and manifestation. Do you remember? I told you a general guideline about cause and manifestation or etiology and manifestation. What is that guideline? What is that guideline? We have yesterday seen in ICD general guideline, I told you. Cause manifestation. Remember? No? No? Can anyone tell me what was that? It's not use additional code. It is code first. Yes. You have to first code the cause. That is the etiology has to be the first code. And then you have to code another, that is the manifestation. So here it is given first code the underlying condition which can cause diabetes. So for example, cystic fibrosis, Cushing syndrome, congenital rubella, pancreatitis, disorders of pancreas, all that you need to code first. The underlying cause has to code first. Then you have to take the code from E08. Now under E08, you can see all the different complications are enlisted. The different complications of diabetes. Like for example, see the first code is diabetes mellitus due to underlying condition with hyperosmolarity. This term is going to be the same now everywhere. Diabetes mellitus due to underlying condition with ketoacidosis, with kidney complications, with CKD, with ophthalmic complications, diabetic retinopathy, macular edema, all that conditions are given here. That is first is for the diabetic retinopathy, right? Then diabetic neuropathy, macular edema, cataract, these are all the retinopathies. Okay. Then neurological complications, diabetic retinopathy, neurological complications, diabetic gangrene, diabetic arthropathy, right? Diabetic foot ulcer, skin ulcer, oral complications of the diabetes, hypoglycemia due to diabetes, that is all E0 diabetes. All right, and this code which you are now seeing, all these expansion codes are present in all types of diabetes. All types of diabetes. For example, see here E09, drug-induced diabetes. Which drugs can cause diabetes? Can you name any of the drugs which can cause diabetes? Which drugs do you think can cause diabetes? Antihypertensive drugs? No, not really. Not really. Most commonly used. If there is no treatment, or for example, there is autoimmune disorder. What is given to the patient in autoimmune disorders? What is the most common treatment for autoimmune disorder? Most common treatment for immunosuppressants, right? Which are those immunosuppressants? Which is the most common immunosuppressant? Corticosteroid, very good. Corticosteroids are nothing but cortisol. And what is the function of cortisol? We have seen in endocrine system. What is the function of cortisol? Is to increase the glucose level. So corticosteroids definitely causes diabetes. Beta blockers, corticosteroids, right? These are the medicines which can cause diabetes. So they are drug-induced diabetes. Again, you know, you have to code first the etiology. So you have to take the toxin or the drug which is responsible for this. The drug which is responsible for the for this diabetes. Now, from where you will find this? Don't tell me the code range. Code range is given already there. T36 to T65. But if you have to look in the alphabetic index, where you will find it? Which part of the alphabetic index you will find the drugs or the chemical? Yes, we have discussed yesterday 4 parts of alphabetic index. In which part of the alphabetic index you will find this? Anyone wants to try? Table of drugs and neoplasm. Very good. Table of drugs and chemicals, right? Table of drugs and chemicals, there you will find the code for poisoning or drug toxin, right? Drug toxicity. So that is E09. Again, under E09, similarly, all the complications are mentioned here, right? So hyperosmolarity, ketoacidosis, edema, macular edema, neuroplasticity, all right? Foot ulcer, neuropathy, arthropathy, all the complications, hypoglycemia, hyperglycemia, coma, without coma, all these conditions. And then you have the code for type 1 diabetes. That is this E10 is the code for type 1 diabetes. Yeah? E10. What all this means? Brittle diabetes, diabetes due to autoimmune processes, diabetes due to immune-mediated pancreatic islets destruction, idiopathic diabetes, juvenile onset diabetes, ketosis-prone diabetes. This all means type 1 diabetes. And then again in type 1 diabetes, you can see all the different complications. CKD, ophthalmic complications, E10355, type 1 diabetes with macular edema, proliferative macular edema. All right. Then neurological complications. And in all that, you have to use the 7 character. Now we have seen yesterday the use of 7 characters, right? You have to use the 7th character. If there is no 5th character is missing or 6th character is missing, you have to use the placeholder. Now, if you have got the type 1 diabetes, the medical record says type 1 diabetes with other ophthalmic complication of left eye. Okay, how you are going to code this situation now? Which will be the code? Can you generate the code now? left eye. Type 1 diabetes with other ophthalmic complication of the left eye. How you are going to write this code? Yes. The code is E10.39. You have to add the 7th character for the left eye. E10.39x2. Very good. E10.39x2. Yes, that is the code. Right? Very good. All right. So these are all. Now here you have to write type, say for example, type 2 diabetes with diabetic retinopathy and macular edema. This is the code. And that is for the bilateral eyes. Both eyes. Both eyes have this type 2 diabetes with mild non-proliferative diabetic retinopathy with edema. What will be the code here? E11.3213. Very good. Great. Right? Very nice. So you don't need to add X or placeholder because already these are 6 characters. So directly you have to apply the 7th character. No need to add the placeholder. Perfect. Very nice. All right. So now this is E11. This is the type 2 diabetes. Okay. The code is for type 2 diabetes. Now in type 1 and type 2, all the cases what we have seen till now, one thing you have to see under each code, each category code, there is the guideline says use additional code to identify the control. What do you mean by identify the control? To identify the control means how this diabetes is controlled, whether it is controlled by oral hypoglycemic, whether it is controlled by anti-diabetic drugs, or whether it is controlled by insulin. So you'll have to give the code from Z category to identify the control of the medicine, control of the diabetes. So if this is controlled by insulin, the code is Z79.4 to show that this diabetes is controlled by insulin, that the patient has to take insulin. If it is controlled by anti-diabetic drugs, okay, can you name some antibiotic drugs? There are two terms. One is anti-diabetic and one is hypoglycemic. Metformin is a most commonly used hypoglycemic drug. It is oral hypoglycemic. Okay, anti-diabetic, glipizide, gliptin, sitagliptin, tenigliptin, glimepiride. Yes, these are all anti-diabetic, right? And metformin is hypoglycemic, oral hypoglycemic. So how this diabetes is controlled, whether it is controlled by insulin, whether it is controlled by any injections or any diabetic drug, anti-diabetic or oral hypoglycemic. So under each category code, you will find this guideline. Use additional code for identify the control, which is the control mechanism. Right? Everywhere you will see this. Under E13 also, identify the control. E13, that is for other specified diabetes. Like for example, diabetes due to functioning of the beta cells. Then post-pancreatectomy, pancreatectomy diabetes. Because of the pancreatic cancer, pancreas are removed. So if there is no pancreas, obviously patient is going to develop the diabetes. Post-procedural diabetes. Right? So these are all the diabetes, other specified diabetes. Again, you have to give here the additional code to identify the control mechanism. Now, one very important guideline is there when you are coding diabetes. If there is no type mentioned on the patient record, if there is no type is mentioned, without nothing is mentioned, whether it is type 1 or type 2. If this is not mentioned on the patient record, what are you going to do? What will you do? You will take type 1 or you will take type 2? What will you do? Unspecified, there is no code for that. There is no code for unspecified diabetes. NEC, use 13. Use E13. E13 is for other specified. No. All right. This is a very new guideline that came in 2023, 2024 actually, that if there is nothing mentioned on the medical record, by default you have to take it as type 2. By default, it has to be taken as type 2. And which is the code for type 2 diabetes? Category code? Type 2 diabetes, E11. Category code, that is E11 is for type 2 diabetes. E13 is for any other specified diabetes, okay? Diabetes due to certain conditions. So by default, you will take E11 if nothing is given on the medical record. Say for example, whole of the medical record is there and only it is written patient is diabetic. Nothing is mentioned about types. Take it as by default as type 2 diabetes, that is E11. So why this is given? Because type 2 diabetes is so common. So usually doctor will write only diabetic. Patient is diabetic. And all of you will call all the doctors and ask, sir, whether it is E10 or E11, whether it is type 1 or type 2. So ICD has given a solution to all the doctors that if nothing is mentioned, it is E11. But at the same time, it is obligation now for a doctor that if it is not type 2, that the doctor or the physician has to give the type. If it is type 2 diabetes, he may just write diabetic patient. But if there is another type of diabetes, then it becomes an obligation to the physician to write it. So if nothing is mentioned, take E11. All right, E11 by default. Okay, clear everyone? Now there are like diabetes, we have seen like the hypertension, pregnancy induced. Similar way, there is gestational diabetes. Okay, there are two different conditions. One is where there is a pre-existing diabetes, that a patient already has the diabetes. That woman who is pregnant, she already has, that lady already has the diabetes since the even before the development of pregnancy. And second condition is where due to pregnancy there is diabetes, that is called gestational diabetes, and we have code under O24 category for the gestational diabetes. The only important guideline here you have to remember, do not take the code from Z category to mention the control, of the diabetes, because the code for gestational diabetes, they themselves have the control codes. The control codes are already given in gestational diabetes codes. Yeah, you can see here pre-existing type 1 diabetes, pre-existing type 2 diabetes, which trimester it is, all right, and this is pre-existing. In that condition, you have to take the code from Z79 where it is pre-existing. In gestational diabetes, which is due to gestation, do not take the code from this category, right? Now here gestational diabetes. It mentions do not report Z79.4 and Z79.84, which is for the long-term use of insulin and long-term use of anti-diabetic drugs. Do not take that. Why? Because read the code. The code describes how the diabetes is controlled. Diet control, insulin control, controlled by oral hypoglycemics, right? And control unspecified. So this is already we have the code for this. So do not report Z79.4, which is the term, which is a code for long-term use of insulin. Now this is gestational induced, so there is no long-term use. Now only patient has developed this. How can you code long-term use of insulin? So do not use this code in the gestational diabetes. Z79.4 and Z79.84, that is the control code of diabetes, has to be only and only used for long-term medication use. Okay, for long-term medication use. So that is the guideline for gestational diabetes. Okay, you already have the code for control mechanism. Whether it is a pre-existing condition or gestational, that you have to use. Again, this is the priority code over all other codes. So the gestational diabetes codes that we have already seen: 410, 414, 415, and 419. Okay. You have to take documentation of the trimester, first trimester, second trimester, and third trimester. We will see this. What do you mean by trimester? All right. So additional codes, if needed, you have to give for the complications. If any complications are there, you have to give the complication. Now, postpartum and antepartum. That is, antepartum means before the delivery, before the birth of the baby, that is antepartum. And postpartum, that is the period after the delivery. It continues up to 6 weeks. This period is continues up to 6 weeks, immediately after the delivery up to the 6 weeks. In that condition, you have to use O24 codes for the gestational diabetes. All right. Diabetes with nephropathy. Now we have type 1 diabetes. Type 1 diabetes with nephropathy. What can be the code? First, you tell me what is the code for type 1 diabetes. E10. Okay. So now automatically B and C option are gone, right? B and C option is gone. Okay. So E10 is the code. Now nephropathy. Diabetic nephropathy. E10.21. Right. E10.21 is the code for diabetic nephropathy. Very good. Yes, tell me. Secondary diabetes due to pancreatitis. Which category code will be there? Due to pancreatitis, E08. E09. E011. E13. E13. Let's see. Okay. Let's see. What is there? Pancreatitis, disorders of pancreas, alcoholic pancreatitis. I hope you remember. What will be E08? Yes, what will be the code? E08 is the right code, okay? E08, which is due to underlying disorder. So you'll have to use underlying disorders over here, right? So E08, diabetes due to underlying condition. So it is due to the pancreas. That is secondary diabetes due to pancreas, right? So now, what is another? E11 represent attendance link is shared. I guess attendance link is shared at 8:30. Exactly at 8:30. Okay, yes. E11 is for type 2 diabetes. All right. Very good. Now tell me true or false. Type 1 diabetes is always insulin dependent. True or false? True, 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 true. Anyone? It's true. There are no insulin secretion. Type 1 diabetes. Why there is type 1 diabetes? Because insulin secreting cells are destroyed. There are no cells. How can there be the insulin production? Of course, now the terminology is not used in IDDM and NIDDM. This terminology is changed. It is not used. But that does not mean it is not insulin dependent. It is always insulin dependent. It has to be controlled by insulin. There is no insulin. Insulin is not at all being secreted because the cells are destroyed, right? Now, gestational diabetes codes are found in which category? E08. Then which category you will find? O category. Okay. Diabetic nephropathy must be coded with the appropriate diabetes code, or you need kidney codes. True or false? For diabetic nephropathy, true. Very good. All right. So there is last one condition that we will see today and then we'll stop. The condition is hemiplegia. What do you mean by hemiplegia? What do you mean by hemi? Hemi means what? Hemi means what? Half. Hemi means half side. Plegia means paralysis. Paralysis of half side of your body, that is called as hemiplegia. Paralysis of half side of your body called hemiplegia. The code ranges for hemiplegia are given in which chapter? Where you will find the code for hemiplegia? It is a disorder of nervous system. So you will find it under nervous system. All right. You will find the code under nervous system, that is G category codes. The codes are given in G category. So now when you are coding for the hemiplegia, that is like G81, G80, these are the codes for hemiplegia. One important coding tip is there where you have to understand, because this is what is going to be, see, whatever I am covering right now, all the guidelines pertaining to the different diseases, taking the diseases which are most commonly coded and which are most commonly asked. Right? So hemiplegia is a situation, is one of them, and you have to write the code for, or you have to understand important terminology. There are two important terminologies, or based on what the codes are given. That is called dominant and non-dominant side. Is there anyone right now in the group who is left-sided, lefty, who use left side more than the right side? Is there anyone who is lefty, right, who uses left side more? Attendance link has been shared. Please check attendance list. Is there anyone in the group who is right now who uses left side more? Have you seen anyone who uses left side more? Any of your relatives must be there. But maximum people are using right side. So now what is there? The side which you use more, that is right side. That is your dominant side. So if I am using my right side, that is my dominant side. Okay. Vinapalli Madhu Kishore, you are using your left side, so your dominant side is left. Those who are lefty, their dominant side is left. Those who are right-sided, their dominant side is right. So when you are coding the hemiplegia, your side, dominant side has to be coded. Which side is dominant? That is important. Why that is important? Now, if my dominant side is right side, if my dominant, that is, I'm using my right side most of the time, and that is getting paralyzed, is it going to affect my work as well? Is it going to affect my work or not? Yes, it is going to affect my work. But if I have left-sided paralysis, I use my right side, but I have got the left-sided paralysis. Now, do you think my work will be affected equally? No. That's the reason you have to code the dominant and non-dominant side to make it understandable by the people that how much you have suffered or what is the suffering, and that's why there are code for dominant and non-dominant side. So for the people who are right sided, dominant side is right and non-dominant is left. So just imagine if a patient comes whose left side is paralyzed, but he uses his left side more. What will be the dominant side? What will be his dominant side? He is the left side. He uses left side more. He uses his left side more. Left will be his dominant. And what will be his non-dominant side? Right side will be the non-dominant side. Now, if a patient is ambidextrous, what do you mean by ambidextrous? What do you mean by ambidextrous? Use the both hands, both sides equally. That is ambidextrous. In such cases, in such patient, which side you are going to take as a dominant side? In such cases, ICD says take right side as the dominant side. Okay, ICD says that take which is common, take right side as the dominant side. And if nothing is mentioned about the dominant side, whether the patient is left-sided, whether the patient is righty, nothing is mentioned, take which is common. Which is common? Right side dominant is common. Okay, right side dominant is common. So when the documentation is not enough, it is better to take whichever is very common, right? So we will just see the codes for dominant and non-dominant sides and then we'll stop. Just a minute. Because mainly you have to take the codes based on the dominant and non-dominant side. So we'll see the code. So you can see here G81, that is for hemiplegia and hemiparesis. There are different types of hemiplegia: flaccid hemiplegia, spastic hemiplegia, unspecified, and you can see the codes are given based on the dominant. So if a patient who is coming with the spastic hemiplegia, okay, with the spastic hemiplegia, and the patient is right-sided, but he has left-sided hemiplegia. The patient's right side is dominant, but he has paralysis of the left side. Now, what will be the code you think? Spastic hemiplegia in a patient whose right side is dominant, but he has the paralysis of left side. What code you will be taking? Which code you will be taking here? Here you have to take spastic hemiplegia affecting left non-dominant side. Left non-dominant side is what you have to take. So the code will be G81.4. Left non-dominant. Now, if the same person, he is not having the left side hemiplegia, he is having right side hemiplegia. Now, what will be the code? He is having now right-sided hemiplegia. He is a person of right-sided only. Right-sided person, right-sided hemiplegia. What will be the code here? G81.11. Right. Very good. Very good. Now, if hemiplegia is there, which is flaccid hemiplegia of the person who is left-sided dominant, jiska left side dominant is there, that is, he uses his left side, but the paralysis is on right side. The paralysis is on right side. Flaccid hemiplegia affecting right side in the patient who is left-sided or lefty, which will be our code G81.03. Correct. G81.03. Very good. All right. So similarly, these are the conditions where you are using the same guideline for monoplegia. Now, what do you mean by monoplegia? What do you mean by monoplegia? What do you mean by monoplegia? Arshia, you are sending direct message to me. I cannot send you the attendance link. Make that message to... Okay. Single leg. It's not leg. Monoplegia of the lower limb is single lower limb. Yes. Monoplegia of upper limb can be single upper limb. Alright? Arm or forearm. So monoplegia means only one limb is not working. In that condition, again, you have to take the dominant and non-dominant side. Again, dominant and non-dominant side. The similar guidelines will apply here. If nothing is mentioned about the dominant and non-dominant, take right side as the dominant one, which is by default. If ambidextrous patient is there, again, take the right side as the default code. So these are the guidelines for coding hemiplegia, right? So, all right, we have seen maximum cases here. What is the default assumption for the dominant side when it is not documented? Right side. Yes. Correct. Flaccid hemiplegia of the left dominant. We have seen this code. Flaccid hemiplegia of the left dominant. We have seen the code, right? Left dominant. The right side is always considered dominant. True or false? True or false? Right side is always considered dominant. False. Otherwise, why they would have given the code for dominant and non-dominant, right? No documentation, then take right side as dominant. But it is not always considered as dominant. They have given the codes for that. Right? Okay. That's it. We have seen this also. All right. All right. Any question, anything you want to ask, anything that you did not understand from the guidelines, from the coding of diabetes, from the coding of hypertension, PDF material in login section. Okay. Okay. I'll give you the PDF material, or I'll give you the slides, but whatever has been put on the slides is not as detailed as I'm describing. So while it is my request, you can see the videos again and again, right? Recordings you can access. So I understand that you cannot take the notes during the live session, but you can see the recording sessions, pause the video, and then you can take the notes. Always possible. Always possible, right? Yeah. Recorded sections, these are available, videos are available. You can pause them and you can take the notes. See, sharing PDF is not a big deal for me, but when you take your own notes, it becomes very easy and it gets settled in your brain, right? So try to take notes from the videos, see the recorded sessions, all right? And pause the videos and then take the notes. Okay, so we have seen today about the guidelines pertaining to hypertension, hypertension induced in gestation, that is pregnancy induced hypertension, types of hypertension as per the ICD's, complication of hypertension, the code for hypertension, that is from I-10 to I-16, the category code for diabetes, all right? So what are the different causes of diabetes, complications of diabetes, code from E08 to E13, that is for the diabetes. You have to typically remember E11 and I10, that is important. E11 and I10, that is for the most common disorder, that is essential hypertension and type 2 diabetes. You have to remember these codes. The complications of diabetes you should remember. You may not remember the code, but at least you should be able to tell the diabetes complications, right? Then gestational diabetes, the control of the diabetes, how to code the control. The code for control of the diabetes, that is Z79.4 for insulin, Z79.84 for anti-diabetic, all right? So all that you have to understand. And then we have seen, no, you don't need to learn the codes, okay? There is no need to learn the codes. Even in CPC exam, it's an open book exam. There are no need, but yes, certain common codes, common conditions. Now, hypertension is such a common condition. Out of 10 records, you will find on 9 records there will be hypertension. So for such situation, you should know the codes. At least you should know the default code or the category code. Do we have to mention while coding which ICD version was referred for future referencing? Not needed. Looking at the code structure, anyone will be able to understand which version you are using, whether it is ICD-10 or ICD-9. ICD-9 is not at all used now. It's only ICD-10. Okay, so there is no need for that. All right, then hemiplegia codes we have seen about the dominant and non-dominant and ambidextrous patients. So this is what we have seen today. All right. ICD-10 book, yeah, I have given. You might check on the LMS. I have shared, and I think they might have. I'm not very sure. Sushmita might be able to tell you if it has been uploaded on the LMS. I have shared CPT book and ICD book also. I'll share some more material like handbook of anatomy and medical terminology, and also the principal guidelines of ICD-10. I have shared ICD soft copy, dear. I have already shared and might be uploaded in LMS.
Yeah, ma'am. Actually, whatever the recordings and materials, everything we will upload in LMS. If it is not uploaded, it will take time. We will upload.
Yes, yes, right. Okay, so be patient just for a couple of days. It will be uploaded. CPT also and ICD also. Okay. Okay, any other question apart from that for today's session? Anything you want to understand, or you did not understand, or you did not like, you did not wanted to hear that? Yes, there will be exam. Yeah. Thank you. So thank you, everyone. Good night, all of you. Take care. Bye-bye. We'll meet tomorrow at the
Yeah,
same
ma'am.
time.
Thank you, ma'am.
Thank you so much. Thank you,
Yeah.
dear.
Yes, students, I have shared the attendance link once again on the chat. If you missed out to mark an attendance, kindly mark your attendance. So we are done for the day. We'll wind up for the day. So again, we'll meet by tomorrow at 7 p.m. Okay. Yeah. Thank you all. Good night.
Thank
Thank
you.
you, ma'am. Good night.
Thank you.